All right, welcome back to the podcast. Sorry for yesterday, I was too tired to sit down and just do the episode. So, welcome back. It is July the 26th. We are Wednesday, and I am your host, Niyama. So, last time, um, it was all about the guide on supplements and also vitamins, specifically designed to support the health and well being of the woman in her middle age season. So remember that it's very important to take care of your heart. It's your most important organ. It's a gift from God. It's a blessing that you need to cherish and nurture every single day. So I explained and I gave you some information so you can best navigate the world of supplements, omega fatty 3 acid. We talk about that. So tonight I'm going to dive into more specifically what is going to be tonight. I don't have my notes. I'm improvising tonight. So it's going to be all about, so we discussed the omega-3 fatty acids. I spoke about EPA, DHA, DSNI, how omega-3s actually can reduce and will reduce inflammation, lower triglyceride levels, and also improve your overall cardiovascular health. I talk about fatty fish, to consume flax seeds, walnuts, because they are excellent source of omega-3s. And also, what did I discuss last time? Just how to optimize your overall health, your heart, your well-being. So tonight is going to be about how to prepare for your menopause season, because at certain age we will indeed start not having our period as women, and it's very important to know how to take care of yourself, how to adjust, with the hormonal shift. So I'm going to explain the hormonal changes and how you can maintain a positive mindset. I'm going to provide you with actionable tips as well as advice to support you, my beautiful sister, in maintaining your optimal heart health and also overall well-being as you are aging, because we women are the strongest. I was about to say the weakest. We are the strongest link indeed. We give birth to children. We go through our periods every single month. We go through different mood swings. We go through so much, and we need to really prioritize our health, our well-being as we grow older. So I'm going to teach you and to help you protect and nurture your heart and also optimize your overall health when you become 50, like me. I'm soon going to be 50 next year, in a few months actually. So there are many physical changes and hormonal shifts during your middle age, such as a word called perimenopause and also menopause. So what are the impacts of those shifts on your overall health and well-being, you may be wondering. So during your middle age, you will experience several physical as well as hormonal changes, especially during the transition towards menopause, meaning where you stop having your period. This phase before getting to menopause is called perimenopause. So typically it starts in your 40s, but it can begin in your late 30s as well. Some women have experienced that. I started experiencing it about a year and a half ago, and I was 48 years old last year. So I'm going to teach you the common changes and also the impacts that they can have on your overall health and your well-being. First, irregular menstrual cycle. So that's when your periods change. So perimenopause often brings changes in your menstrual cycle, so including you bleeding less or bleeding more, So it depends. It can be short or they can be long as cycles. So this is due to fluctuations in your hormone levels, and everybody is different. Every woman is different, but this is definitely due to the fluctuations of hormone levels, particularly estrogen and progesterone. So the number one is irregular menstrual cycles. The number two changes as you head towards your menopause season would be hormonal shifts. So as women approach their menopause season, there is a decline in the production of estrogen and also progesterone. These are hormones changes that can lead to various symptoms such as having hot flashes, and I remember having them last year at night. I would be hot, cold, and I would have night sweats and also mood swings, and also you can have sleep disturbances and also vaginal dryness and just a decreased libido. But it depends, like I said earlier, it depends on every single person. Every individual as a woman is different because each of us have a different body. So that's number two, hormonal shifts. Then number three, changes that you will see towards getting to your menopause season is your bone health. So estrogen plays a crucial role, as you know, in maintaining your bone density. So with the declining estrogen levels during your menopause or perimenopause, you will see that you are at an increased risk of developing a disease called osteoporosis. You probably heard it on the television or on the news. So you may develop some fractures as well. So it's very essential, very important that you focus on lifestyle factors like a calcium-rich diet. You have to be very careful to consume more calcium. Also weight-bearing exercises, and also if necessary you need to go to a doctor, consult a healthcare professional about some potential treatments as well as supplements. And the episode a day ago was all about supplements and vitamins. So it's very important as you age. Number four change that you will see is your cardiovascular health. So the estrogen has a protective effect on the cardiovascular system, including maintaining healthy cholesterol levels and your blood vessel function. So with the decline in estrogen, a lot of women who are going in menopause season, they are at an increased risk of heart disease. So be very careful. So to mitigate this, it's very crucial to adopt heart healthy habits, like I always say, regular exercise, having a balanced diet, eating fruits, vegetables, having also the ability to do stress management, and also regular checkups to your doctor so you can make sure that you are healthy overall. Number five change that you will see is weight changes. So hormonal shifts during your perimenopause and your menopause season, they can contribute to weight gain, particularly around your abdomen, your stomach. So the decrease in estrogen levels can affect metabolism and also lead to changes in the body composition. That's why you will see a lot of women that when they are in their 50s and their 60s, they're very heavy around their waist, around their stomach, and they need to really take care of exercising and take care of their overall health. So maintaining a healthy lifestyle, including regular physical activity as well as a balanced diet. The older you're getting, the more you have to be vigilant and really be alert and be careful what you eat. And this can help prevent weight gain as well as improve your overall well-being. So important. So number six change is in your mental and also in your emotional well-being. So hormonal changes can also impact your mood, your emotional well-being. You can feel more frustrated, you can feel more aggravated easily. And it took me a long time to finally acknowledge that, the reality for my own self. And I have to really change. So, and some women, they may experience mood swings, irritability, being really aggravated easily, upset, have mood swings, anxiety, depression during the menopause and also the perimenopause before getting to menopause. So remember, my dear sister, practicing self-care is so important. Seeking support from people that love you, that care about you, that support you, and also always, I say, healthcare professional, people that know what they're talking about, that care about you, your doctor, your physician, and just explore different techniques like meditation, therapy, because that will help you manage these different changes. So it's of course it's very important to know that every woman's experience during this phase can vary, and not all women will experience severe symptoms. There are women that go through menopause like a piece of cake, like nothing has changed, you know. So just remember that, and you need to stay informed about the potential changes in and the impacts on your wealth, on your health, because that can empower you to proactively manage your well-being during middle age and beyond. It's very important. Remember, sister, you need to take care of your health, and you need to really think on the long run. You know, if you truly want to live up to 90 or even 100 years, you become a centenarian. I made a video about that, actually, about people that live over the age of 100 and all the amazing things, the strategies that they advise, and the practical tips how to live a long life, being happy, being healthy, feeling content. So if you too, sister, want to live up to that age, I really highly recommend that you really take care of your health, that you eat healthy, that you use more omega-3 fatty acid, that you consume legumes, nuts, if you're not allergic, flax seeds, that you exercise, that you really take care of your overall health, mind, body, soul. It's very important. So you have to remember to take care of your joints, your bone health. So a lot of Americans are suffering from different joint chronic pain diseases like rheumatoid arthritis, osteoporosis, and other arthritis diseases, and it's due to the fact that a lot of people are super stressed out, and a lot of people have a very bad diet, nutrition. They don't really care. They go eat at fast food restaurants. They don't prioritize exercise, working out. They don't care if they should take supplements, vitamin supplements, and they forget to maintain the optimal bone health throughout life. That's why a lot of them, when they reach 60, 70, they start having all these problems, feeling pain on their shoulders, on their knees. And I have to remind, you know, when I talk to elderly ladies, that the older you get, the more important and crucial it is that you have to take care of your body. And sometimes I see women that at their age they are smoking, and I want to go towards them and let them know, you know, you are not doing your body a favor by smoking. You really need to take care of your body. You need to nurture yourself and realize that you are put on this earth to help other people. You need to be healthy. You need to have a healthy heart, and you need to take care of your bones, your joints, and that your body deserves it. And it starts with a mindset. You need to shift your mindset. You need to realize that you are what you eat, and if you constantly go to the fast food store, the restaurant like McDonald's, Burger King, all those restaurants, they provide fake food, unhealthy food. It's really bad, and in the long run it's going to really be detrimental to your health. So this is why I'm doing this podcast episode. I really want to share with you that knowledge and how it's so important that you need to really think about the future when it comes to your health. So to nurture your bone and your heart health, it's important to adopt a holistic approach that includes your lifestyle choices, nutrient, exercise, and also preventive measures. So I'm going to give you a few tips for nurturing your bone and your heart health, and then I will end up this podcast for tonight. So first, you have to maintain a balanced diet, like I said earlier. So you need to consume a well-balanced diet rich in fruits, vegetables, whole grains, lean proteins, and also healthy fats that can provide your body with the necessary nutrients for your bone and your heart health. So please, sister, incorporate fruits that are high in calcium, high in magnesium, high in vitamin D and omega-3 fatty acids, like I said earlier, because these are very important for your bone strength and your heart function. Number 2, you need to get regular exercise. So you have to engage in weight-bearing exercises such as walking, jogging, even dancing in your room or weightlifting, because these activities can help strengthen your bones, and it also help maintain a healthy weight. It will improve your heart health, also promote overall fitness. So aim for at least I would say 30 minutes of moderate intensity aerobic activities, or 1 hour of just you being active every week, along with strength training exercises 2 or more days a week. That will really be very helpful for you, for your overall well-being. So number 3, you have to maintain a healthy weight. So being overweight or obese, like so many Americans, so that can put extra strain on your bones and your heart. I remember a few years ago when I went to the doctor, they said that I have to have an operation because my bones, rheumatoid arthritis on my knees were really hurting, the inflammation, because I had put too much weight. So I said I'd rather go on a diet and stop. So I did a lot of fasting instead of having operation. So just strive to maintain a healthy weight through a combination of regular exercise and also healthy eating habits. Very important. So when you combine those two, you are going to have a fantastic life while you're going through menopause, perimenopause, and you're growing older. Number 4, you need to avoid smoking and also alcohol consumption. If you can completely eliminate drinking alcohol, is even better, because you know that smoking can damage your bone and your heart health, and it accelerates bone loss and also increases the risk of heart disease. And additionally, excessive alcohol consumption will contribute to bone loss as well as heart problems. Later down the road, you will suffer. So it's best to avoid smoking altogether and also stop drinking alcohol. If you are a person who is here and you are not Muslims and you're just wondering why I'm making this video, well, it's for you as well. I want you to have optimal health and to be healthy while you are growing older. So number 5, you need to protect your bones and protect your heart. So just take precautions to prevent injury and also to protect your bones from any fractures. So this includes wearing appropriate protective gear during your physical activities when you're exercising, and also using proper technique when you're lifting heavy objects. Even if you are lifting a big bag of rice when you go to the supermarket, do your grocery shopping, you have to be really careful how you pick up those heavy items. Usually, you have to bend your knees and have your back straight while you're lifting heavy objects. So just ensure that your living environment is free of hazards that may contribute to you falling it can happen. At any age, we can fall and really hurt ourselves, even break bones, break finger, break some teeth. It happened to me, and I was what? I was like, I think 45 years old. So yes, it can happen to anybody. Number 6, you need to manage stress. So chronic stress will have a negative impact on your bones and as well as your heart health. So just find healthy ways to manage your stress, such as through exercise. A lot of people that exercise, that work out every single day, that go to the gym, or even they have their own home gym, they are not so stressed out compared to other people. So just do some meditation, work out maybe 5 minutes on your bike if you have a home bike, or take on a hobby that you enjoy, like knitting, crochet, or painting, drawing, reading. Just something that you enjoy doing. And also seek support from people that love you, or if you can, go to see a therapist, or go online to betterhelp.com and find someone online to help you as a therapist. Number 7, you need to get regular checks-up, just routine checks-up and screening with your healthcare provider, your physician, your professional, your doctor. So they will identify if you have any potential bone or heart health issues, and they can really identify them early on. So they can provide guidance on managing your existing conditions, and also they will offer you personalized recommendation based on your specific needs. So my beautiful sister, just remember, it is always recommended to consult your healthcare professional, your doctor, for any personalized advice regarding your bone, your heart health, because these people provide tailored guidance based on your medical history. They will ask you all type of questions about your family history. They want to know everything so they can help you. And it's very important that you tell them the truth. Just be transparent. If you have history in your family, people that have cancer, that have heart disease, just let them know. So this is it for the episode tonight, all about perimenopause, menopause, how to nurture your heart health and also your bones. And I hope that you have taken some notes. Remember, sister, I'm here to help you. So tomorrow I might do a podcast covering also plant-based nutrition as you age, prevention, treatments, lifestyle interventions, and a lot of practical and informational strategies that can help you improve your bone health and prevent osteoporosis, for example, or even rheumatoid arthritis, like what I have had for the past 21 years. All right, my sister, thank you so much for staying all this time. It's been 22 minutes. I hope you enjoyed this episode. Until next time, remember, stay blessed, stay learning, stay focused, keep going, take care of your heart, cherish it, nourish it, nurture it, and as always, be unbreakable.